My name is Pamela McSpadden. I'm a licensed professional counselor. I have a private practice in Vernon, Texas. My facility is Council Smith Cottage. My maiden name is Smith, and I wanted to honor that, and also to honor my father, who had a great interest in psychology and an associate's degree in psychology. It actually took me quite a long time to get my license. I went to school for my master's in counseling, and I had a full-time job, and I had a family with 2 children, so I took it very slowly. I feel like I get paid to talk to people, to be kind to people, to encourage people. I have always been inspired by the strong people in my life. I had a very strong mother and a very strong father, and they were both very inspirational to me. They always had very high expectations for me. They knew that I wanted to be a helper. They were my cheerleaders after I got my bachelor's to go on and get my master's, and they were always so very proud of me. My husband has always been a big supporter of mine. When I wanted to go back and get my master's in counseling, that was not an easy feat. I was very blessed to have a husband who supported me and encouraged me, and my mother-in-law, who was the kindest woman to come and help me take care of the children when I needed to study or go to class. I had sisters who encouraged me, a brother who encouraged me. I always had family support. I have 2 great kids. They're always very encouraging. I always want to think that they're proud of me, and I'm a role model for them to go out and make their dreams come true and set their goals and reach their goals as well. With the current pandemic, we're in a small town and we have not had very many cases. We've only had 3 active cases in our entire county, but we are surrounded by other counties that have more cases, and I do see clients from surrounding counties. So I have expanded my practice to an online format. I use the format called Simple Practice, and it's HIPAA compliant. So it's a safe and secure format where I can counsel clients online. They can see me, I can see them through teletherapy. It's been pretty successful. It's not as successful with young kids, because with most of them, the younger ones, I do play therapy. Can't really do play therapy online. It has been a challenge because one of my areas of expertise is EMDR. I'm EMDR trained based on eye movement and reprocessing in the brain, and it's a therapy that I enjoy because it is so effective with so many clients, especially trauma clients and clients who have a lot of anxiety, because there are a lot of self-calming aspects to it. It's great in the office, but online has been quite a challenge. There are a lot of things that people can do to calm themselves when they start becoming anxious. They can do deep breathing. This basically consists of breathing in and counting while you're breathing in to the count of 4, holding to the count of 2 or 3, and then breathing out to a count of 5. Sometimes when we're really anxious, our brain is going all different directions. When we're asking our brain to count with our breathing, then we're focusing in on that counting, and our brain is not so scattered. With COVID-19, we are seeing more anxiety, obviously, because we don't, what we do know about the disease, it evolves and it changes every day. New symptoms come out every day. There have been deaths from this disease. People are trying to keep themselves safe. So we are seeing more anxiety. I'm seeing some clients who are very anxious to even go to the grocery store, and when they get their groceries home, they're wiping them down, and we're seeing a lot more anxiety with that, especially if they're immune compromised. And we are also seeing more depression because people are isolating themselves. One of the things that I tell my clients is, it's not good to be isolative. Get out and connect with people. And now we're having to tell people, don't connect. Stay in the home and isolate yourself to keep yourself safe. And so naturally, clients are having to calm those resources and find those use those self-calming techniques to not be anxious, and they're having to find ways to connect to people without actually being with people. We recommend lots of things. We recommend, daily phone calls. We recommend using some kind of an online format so that you can Skype with someone or FaceTime with those that you love to keep in connection with them. I love my job. I also love owning a private practice. I love the flexibility of making my own schedule. I love the interaction with clients. I love having my own business. I like being a businesswoman. So even though it took me a long time to get there, I think it has all been well worth it. It's a very fulfilling career, knowing that I'm helping people.